Welcome everyone. Thank you for joining us for another NetHope Solutions Center webinar. My name is Madeline No and I'm from NetHope, and today our topic is skills and standards for a digital workforce. Today we're joined by four organizations, IntraHealth International, the World Health Organization, Pyramid Learning, and the University of Manchester. Before we get started today, I'd like to go over a few housekeeping guidelines for today's session. Please keep this session interactive. Post any questions or comments you have in the Zoom chat window and for our Q&A discussion at the end of our hour. Please also look for a follow-up email later today or tomorrow that will include a link to the recording and the collateral for the session. You can view this session later today or share it with colleagues. Also, we encourage you to complete our webinar satisfaction poll that will pop up at the end of the session. Your feedback is very important to us, so please take a moment to do that. And with that, I will hand it off to Sonia Rutzel from Catholic Relief Services.
Thank you very much, Madeline, and thank you very much, NetHope, for co-hosting this with us. And thank you all for joining us on a webinar for skills and standards for a digital workforce. We thought this is a very topical topic, as most organizations are programming at a distance right now using more digital technologies than often ever before. And all this is creating a bigger need to skill up internally, but also to better support partners globally. So we have assembled a very diverse speaker panel for you to share their firsthand insights on identifying ICT core competencies, share lessons learned on the process on developing skill standards, and also how to manage those distant learning for a more digital skilled teams. And so it's my pleasure to welcome our speakers. We have Jody Liss. She's Senior Advisor of Learning at IntraHealth International. We have Derek Munini. He's the Unit Head of Capacity Building and Collaboration at the Digital Health Department at the World Health Organization. Michael Culligan, he's the co-founder at Pyramid Learning, and Richard Heeks, Professor of Digital Development at the Global Development Institute at the University of Manchester. Well, thank you all very much for joining us and for sharing your insights. Without further ado, I'll hand over to Jody to kick us off. And I'd like to mention that for our audience, you're very welcome to post any questions for the speakers or in general for the discussions in the chat box. We will have plenty of time for those later on. So thank you, and Jody, over to you.
Thank you very much, Sonia. Hello, everybody. Very welcome, warm welcome to you all. I'm really happy to be here. As Sonia said, my name is Jody Liss. I'm the Senior Advisor for Learning at IntraHealth. For those of you who are not familiar with IntraHealth, it's an international NGO. It works in the health sector. We are working to improve the performance of health workers and to strengthen the health systems. I've been working specifically in the field of digital learning for many years of how do you integrate technology into the classroom and into education and training in general. And so this is what we're going to talk about today. Is building a competent digital literate workforce. So I want to share with you several examples and several ideas of how you're able to do that. Before we start, I'm not having fun with my screen, am I? Well, now you know what I'm going to be talking about. I apologize for my screen not working properly. I'd like to first start with thinking about how you think about learning. When you started to learn something, what were the steps that you had to go through? What were you thinking about? How did you be able to learn something new? And what I want you to start to think about is how learning to tie your shoes, something really simple, going way back when. What were the steps involved to be able to learn how to tie your shoes? Did you use a standard knot where you just created one loop? Or did you use the bunny ears techniques where you created the two loops to tie your shoes? And the reason that I'm talking about this is because it's a series of steps to learn how to do something, to perform a certain task. And that's what we're going to be talking about more today, is that you're going to go through a series of steps to be able to learn to use something in technology, but there may be different ways to learn how to use that technology. And that's how we're going to start to think about building competencies. The competencies are the observable ability of a person who has the knowledge, skills, and attitudes to perform certain tasks. So that's what we're going to be thinking about as we're building these digital literacy frameworks, and making sure that a person who is competent because they have the ability to perform these tasks. So what does it mean to be digital literate? The SDG4 is on quality education, and as part of that, it is to increase the number of youth and adults who are able to have relevant skills. And one of those skills is about digital literacy. And one of the indicators is the percentage of youth and adults who have achieved at least a minimum level of proficiency in digital literacy skills. So what does that mean to have a minimum level of proficiency? How are you able to achieve that? And this is one example of it. For those of you who live in Europe, and other people may be very familiar with this, it's been around for many years now, the Digital Competency Framework for Citizens. And I just wanted to be able to show you this as an example of a digital literacy framework and all the different things to think about as you're developing it for your specific audiences. So this is for citizens, and this is what we want to talk about. What are those basic digital literacy skills? So what's first interesting to note is there's these 5 different domains about safety and about communication and collaboration. So these are the 5 main areas for digital literacy. Next, what you need to start thinking about is under these 5 different domains, there's a total of 21 competencies. So each of these domain areas have very specific competencies to be able to do those main skills under that area. So just take a quick look for domain area number 2 and these competencies. There's 6 of them because I'm going to go back to them in just a couple of minutes. So you're thinking about interacting with digital technology and about identity. So again, 5 domains, 21 competencies for those domains. Now, what's the level of proficiency for each one of those competencies? In this framework, there's actually 8 levels of proficiency. They have a really great analogy of how you think about these different levels of proficiency. It works for those people because it's about swimming. It may not work in many contexts, but there are contexts that this will work very well in. So when you're thinking about levels of proficiency and you're thinking about swimming, you're first getting your feet wet. Then you're going up to your waist. Next, you're going to put your head under the water. Next, you're going to be able to swim. Then you can save somebody and work with these people to be able to teach them and to save them. Then you're going to do some paddleboarding or on your surfboard, and then you're going to have a very highly specialized area of what you can be able to do in the water. So you have these 8 different levels of proficiency. I'm tying this all together. As I mentioned, there was the 5 different domains. So domain number 2 is on communication and collaboration. And then one of the competencies is interacting through digital technologies. And then these are all the different levels of proficiency for that one competency. So in this area, you're just going to be able to select and identify very simple technologies, all the way up to being very highly specialized to be able to create solutions for different problems. So that's one area of digital literacy framework, and there's many, many other ones. And these are just to give you a few ideas of some of the other frameworks and how people are thinking about it. So there's a lot of ones for digital skills for life and talking about tomorrow's digital skills. There's ones for youth, there's ones for children, and they're put out by many organizations and many different types of groups. And I'm going to focus now on one of those audiences. There's the UNESCO ICT Competency Framework for Teachers, a set of competencies for teachers to learn how to integrate ICT into their teaching and learning. This happens to be version number 3 put out by UNESCO. So they've been actually around for many years and working on how that, because as we know, technology changes, so your digital literacy skills are going to change and evolve as well. The way this one is set up is there's 6 different domains. These are your domain areas. And then there's 3 levels of proficiency. And each one of these will describe what that level of proficiency is. And then it will, under each of these different areas, you're going to be able to see all the different competencies to be able to reach that level of proficiency. So this is another example. What's great about this UNESCO framework is that countries have used it and adapted it for their own. So many countries have their own set of teacher competencies that they've been using and training teachers on how to use technology. And in OER Commons, there's actually a big portal that has all of these different types of frameworks and competencies for you to all to check out. And the last one that I want to introduce is about global standards on digital literacy and skills for readiness. And it's based on one that's been reviewed by, they reviewed 25 frameworks, and it's also based and included on the OECD Future of Education and all the SDGs. So this one has 8 different domains, and each one of these has different competencies. What's a little bit different that they brought up in this one is the digital emotional intelligence. And so it's talking about empathy and it's talking about self-awareness. So as we've learned more about digital literacy and the competencies you need, we're learning more other areas that you need to be competent in. So as you move forward, please think about your audience and who you're working toward to build their digital literacy skills. Think about what are those competencies and what you want them to achieve. What are those main domains that the competencies will be in, and what the proficiency levels for each one will be in there. So competencies are here, there, and everywhere, and I look forward to the discussion. Thank you very much.
Thank you very much, Jody, for the excellent introduction to our topic. We will share the slides and also the web links afterwards, so no need to take note of them just yet. And next up, we hear about a specific skill framework at the Department of Digital Health and Innovation at WHO. So Derek Munini, he's the head of capacity building and collaboration, and will share some insights with us. So over to you.
Thank you very much. Hope you can hear me clearly. Sound check.
Yes, we do. Thank you.
Thank you so much for that introduction, and viewers, thank you so much for your time to join us. As has been mentioned, my name is Derek Munene. I lead a team at the World Health Organization headquarters that's really focusing on capacity building and collaboration within the context of digital health. Personally, I have been in this space for about 20 years now, working with end users of all categories and levels, specifically focusing on making sure that the digital health tools that we're promoting are utilized and accessible. Now, this topic is important for the organization as well as member states because of the different benefits that digital brings. And digital is nothing without a competent health workforce. And so we are really focusing on making sure that the different digital tools that are out there are understood, utilized, and scaled appropriately with a view of receiving the benefits of health outcomes that are improved. On the next slide, you'll be seeing the context in which the organization has been working. We have a resolution that was passed in May 2018, which governs the rest of the organization's activities within our 13th program of work. That resolution promised, or at least spoke to, the need to provide mechanisms, especially through digital means, that empower the health workforce within the ministries of health, and also recognizing that some of these skills are needed within related ministries, such as the ministries of ICT and the ministries of education. So within this particular resolution, we have been promoting a global digital health strategy that responds to the resolution with 4 objectives, 3 of which, as you see on the slide, speak towards the issue of digital health competency, digital health learning, digital health literacy for the health workforce. Now, as a background, the topic that we're discussing is really on at national level, enshrined within national digital health strategies that are made up of 7 pillars, including leadership and governance, strategy, services and applications. One of the pillars, the pillar that has a red square around, is workforce. We recognize that for the past 7 years or so, we have been advocating the production of digital health strategies. Now, these strategies are nothing without applications and tools and services. And these applications, tools, and services are nothing without a competent health workforce that is able to use these particular tools. With that consideration, on the next slide, we have a framework that we've been using to condense what it means and so we've stratified 4 levels of actors that we have tentatively labeled as strategists, tacticians, practitioners, and people. This is a work in progress terminology system that recognizes the spread of digital health actors that need capacity building. And so at the top level are the decision makers, who usually are the ministries of health ministers. They are the departmental directors. They are also in our agencies, directors of programs and etc. These are really charged with setting the vision. And so what we're really probing there is what kind of competencies are needed around digital for them to be able to make the decisions at which they are positioned to make. And below that are the national actors or heads of digital programs in NGOs that have tactical responsibilities. And these responsibilities would include designing a national strategy, selecting digital health interventions, selecting tools for digital health for programs, and so forth. And so this layer of tacticians are also responsible for ensuring that there's a capable health workforce within the country. And then at the bottom, the third layer constitutes the user base, the actual health workers that are responsible for carrying out health services using digital tools. And the area of probing there is what kind of competencies are needed for these cadres to be able to use the digital solutions effectively. Now, as Jody was speaking, at the bottom of the pyramid are people. And in one of our slides, he has ably talked about what kinds of expectations anticipated for the users of these digital health interventions. This is especially more important in COVID times, where we're seeing a lot of solutions targeting end users, in this case, health seekers, to actually interact with the health systems using digital tools. Now more than ever, it's become more apparent for us to ensure that the competencies expected of the population to enable them to use the health system digital health tools. And we recognize that this requires contextualization. It requires beyond discussions around digital health, but also digital health literacy, which is the understanding of what digital health services exist there. And so on the next slide then is a framework that we have been articulating that's really built upon a digital health competency framework across the 4 actors I've talked about. And this framework is intended to inform the actual courses or curricula that are used to achieve the aspirations of the framework. We have so far developed a framework that is staged at the tacticians level. And this framework really speaks to, as Jude was speaking, to the knowledge expected out of these courses, the attitudes expected, and also the skills. These 3 things are collectively referred to as behaviors. And so a number of courses have been designed against the framework, such as the Digital Health 101 course, which is an 8-module course that is intended to provide a means of achieving the expectations or prescriptions or details that are in the digital health competency framework. The intention also is to make sure that other courses that are being developed to any of the cadres that are in the pyramid are also designed in such a way that they meet the aspirations of the competency framework. And the overall goal is to ensure that we have an appropriate assessment framework to assess the proficiencies, as Jody was speaking. And the grand goal is to enable the production of an adaptable, competent health workforce that is able to use the digital tools. Now, on the next slide, which is indeed one of my last slides, is a summary of the journey that we're in. So we have built a competency framework. This has been built over the past 2.5 years. And the competency framework was built by engaging the actual end users, in this case, the tacticians. It was reverse engineered because the course was designed first, deployed, and then feedback received, which informed the competencies expected of tacticians. The competency framework was built around Bloom's taxonomy, skills, knowledge, and attitudes, as Jody was speaking. And the framework itself is intended to inform your maturity module around the health workforce. So over and above building a framework, one needs to make sure that there are capabilities of how to measure progress of that competency framework. How do we know that the components of the competency framework are being attained, being demonstrated, and being evaluated by the program managers? So what you see in the middle is an example of a maturity module for community health workers that has a number of domains, including ability to use data, ability to use ICT skills, ability to use digital health tools, and so forth. That empowers a national actor to measure the progress. And on the right side, that triangle is the triangle we spoke about, which really defines the user base. Who are we targeting? And so some of the lessons we've learned in producing the competency framework and the course are really around the digital health principles, the digital principles of developing digital tools, which really begin with designing with the user. So we've designed this competency framework with a target audience, engaged them, gotten their feedback, and also took them through some of the experiences from other countries to be able to refine the feedback provided and also to make sure that the feedback is representative. With that in mind, I would like to end here and looking forward to a good discussion.
Thank you very much, Derek. Our next speaker is Mike Culligan. He's the co-founder of Pyramid Learning and will particularly share with us on how to teach those core competencies digitally and how to manage credentials. So Mike, over to you. I know you mentioned that you might potentially have some internet problems, so fingers crossed will be good.
Hello, I am having internet problems and I'm doing my best to address them. If you could just respond in the chat that you can in fact hear me.
Yes, we can. Thank you.
I'm using my cell phone and hopefully this will work. My Wi-Fi has had some problems, so I'm off my computer. I'd like to start by providing a brief introduction to, if you could continue to the next slide. First, a bit about myself. Pyramid Learning is an organization you might not have heard of, but I've been working in this field of digital learning for a very long time. I first started working in international development in 1994 at Catholic Relief Services, which was the first year that Catholic Relief Services had email. It was also the year of the violence in Rwanda. And there was an ODI report that came out after kind of an after-action assessment of what went wrong in Rwanda. And one of the things that jumped out at me at that point is that the host country national staff was 10 times larger than the foreign international staff in the international NGOs, but they were 10 times less likely to get access to capacity building resources. And I always found that very interesting. And as I continued to work across Latin America, Eastern Europe, and Africa, and Asia, which I did for a long time, I became more and more convinced that the strength at Catholic Relief Services and the other organizations was in fact our local partners and our national staff, our host country national staff. And yet they lacked access to resources. So I worked at Catholic Relief Services for 13 years and around 2001, I shifted my focus and became the senior advisor for digital learning, for e-learning at the time it was called, and quickly realized that we didn't have the money, the resources, or the knowledge to actually do what I was supposed to be doing. And so I called up a woman at Save the Children very quickly and said, I don't know what I'm doing. I don't have a budget. I don't have the resources or the experience or the training to get this done. Can you help me? And within a month, we had 7 organizations meeting once a week. And we created unofficially a group called Lingos, and Lingos was learning for NGOs. And the idea with learning for NGOs is how do we, with Lingos, was how do we establish systems, standards, and resources for digital learning for any organization working in development and humanitarian aid. That organization merged into Humentum, and just recently I've continued starting Pyramid Learning. And all that time, we've really been focused about how do we improve the standards, skills, resources for digital learning across the development and humanitarian aids sector. And if you'll go to the next slide, I want to talk about two things we've done over that period of time that I think really relate to the objectives of this webinar. There were three objectives, and I'm going to talk about two of them. The first one is at the top of the screen, and it says how to build a competent digital workforce. Back in about 2002, when we first met, the group that formed Lingos, those 6 organizations at the time, said, wouldn't it be great if we got resources so we could have an online learning system that our staff around the world could access? Those learning systems are called LMSs, learning management systems. At the time, nobody had one. And we were able to work with the private sector in kind of a charitable, we don't cost any extra money to provide you an extra seat. Would you provide us the software and the courses to get this started? Since then, a number of organizations have taken that same model. And as a result, there are an abundance of learning management systems and courses that provide free access to courses online for the staff or individuals of development and relief organizations. That LMS circle in the middle of the screen lists 4 of those organizations. As I mentioned, Lingos became Humentum, and that's in the circle. Humentum has worked very closely, and I've worked very closely with the Humanitarian Leadership Academy, which has the Kaya platform. There is also Disaster Ready, which is out of San Francisco, and associated with the Cornerstone Foundation. And then in England, there's the Charity Learning Consortium. Now, all of these provide resources, and the reason I have this screen shaded in white on the right and left on pink on the left is that on the right-hand side is the model where a lot of these organizations provide organizational learning management system access to, I threw out 3 organizations, Catholic Relief Services, Save the Children, Heifer International, but in fact, hundreds of organizations now have access to these learning management systems and the resources on them. On the left-hand side are individuals, and individuals can create accounts to organizations like Kaya, like Disaster Ready, and access courses there as individuals. Included in those libraries are many curricula based on digital skills. I found the information from Derek really interesting with regard to all the competency areas. And I will say that I don't think it addresses all of those, but a great number of them are included in these free resources that are out there, which is a huge advance from where we were when I first started in this area. If we can continue to the next screen. The second objective of today's webinar was how to teach and manage credentials digitally. The second area of work I've been involved in since 2002 is setting up certification standards for humanitarian and humanitarian and development professionals around the world. On the left-hand side, I mentioned we've reached well over 50,000 individuals credentialed, meaning with certifications, independent certifications. Of those people who are certified, there's actually many more who have gotten our learning, hundreds of thousands. The 80% of them are in the developing world, and 40% of those people are from local host country national NGOs. Some of the standards we've set up, and I've written most of these books that are here and set up the standards, are in monitoring and evaluation, in financial management for development, in project management for development and relief, and in program management for development and relief. Now, if we continue to the next screen, what we have emphasized is that these standards be applicable to our sector, adaptable to the needs of a global audience, and appropriate to the context that people work in. And in order to meet those 3 A's and reach scale, we've really made an effort that each of the standards that were identified meet the qualifications that you see on the screen. In the center of the circle, all of them are associated with certification exams. And those certifications, if you go up to 11 o'clock on the circle, are all based on established bodies of knowledge, a guide. And from there, around the circle really focuses on the different learning approaches that we have put in place to make these appropriate to the needs of the organizations and the individuals that adopt them. So we do MOOCs, we do facilitated e-learning of smaller groups. I'm going counterclockwise as we go under certification exams. We also do self-led e-learning that's always mobile and can be accessed on digital devices. And then the DPro Starter, these are performance support site with instructional videos and then can be accessed on a just-in-time basis. What we find is that if you want to professionalize the skills of development and humanitarian aid professionals in these core areas that we think are so important, it's very important that you reach them where, in an appropriate manner, where they are ready to learn. And that might be via a MOOC, but it might be a just-in-time learning. It might be reading a book, and we try to click every box. Well, we do click the box on every one of these standards on the screen right now so that we can reach people when they need it, where they need it, and at the price point they need it. The underlying message from these three slides that I really want to emphasize is that all the success has been through collaboration. From the beginning, the first phone call between myself and Save the Children was, I don't know what I'm doing. I don't have the resources, what I'm doing. I will do better if I can work together with you. And I believe that humility is a strength for us, because when we start to do what we're doing today, where many organizations are coming and work together, I think it resonates and people say, me too, let's work together. And from that point, I think we can do great things. And I really commend NetHope, CRS, and others from ICT4D for adopting that approach in this webinar. There's a lot I've covered, and I'm more than willing to answer details as we go into questions, but for now, I'll stop there.
Thank you very much, Mike, and I'm glad the internet seems to be better now. Now, before we get into the discussion, I also invited Richard Heeks to share his reflections on ICT4D competency building. Yeah, Richard, very interesting to hear your thoughts on this topic.
That's great. Thanks very much. I have to say, despite my city's bad weather reputation, I should say greetings from sunny Manchester. So I'm Richard Heeks. I'm director of the Centre for Digital Development here at the University of Manchester in the UK. I've been working in ICT4D since long before it was called ICT4D, but I am the author of the ICT4D teaching textbook, and I'm also director for Manchester's master's program in ICT4D, and it's from that postgraduate training perspective that I'm going to speak. I'm not going to say much about how we teach, since I think good practice is fairly straightforward, which is active learning as much as possible, so group projects, case studies, exercises. In the case of our degree, a couple of weeks in South Africa immersed in field projects. And I'm going to say nothing about credentials and certification, because all of that is very formalized, and I'm sure most of you will all be very familiar with how university systems work, and that's true for us whether our on-campus or our distance learning offerings. Instead, I've got 3 points to make. Point one is that to be successful in the ICT4D field, at least in terms of the early to mid-career progression that our participants are working towards, you need to be not a hybrid, but a tribrid. That is, combining competencies in 3 key ways. So you need to know how to develop ICT4D systems. I'm meaning they're not necessarily the detailed nuts and bolts of programming and system building, but agile systems analysis and design methods, and of course the principles for digital development. You need to know how to manage ICT4D projects. I'm thinking there obviously of finance and people and dependencies, etc. And you need to understand development, its current goals and sectors, the different development paradigms, the micro and macro politics of development. So all three of those are needed to be an ICT4D champion. Point two is that something that certainly Jodie and Derek have already trailed, which is that to be successful in the ICT4D field, you need competencies, which are more than just skills. In training, often in our discussions, our language, it typically or often circulates around the notion of skills. But at least from our graduate teaching perspective, and as we saw from some of the other panelists as well, there's an argument that those are the least important of the three. They're the ones that are most readily lost or superseded. And certainly when we ask our alumni what part of their master's program is proving most useful for them in their ICT4D careers, the answer is always knowledge, specifically the conceptual frameworks that they've learned. These are like new eyeglasses, new ways to understand the world of ICT4D, analytical lenses that give you a deeper or a more strategic perspective. The third one, attitudes, I feel we've not perhaps paid sufficient attention to. So things like views on, say, inclusivity or sustainability, I guess they may be picked up as a learning byproduct, but I'm not sure we even know what we would regard as the right attitude set for ICT4D. And it would certainly be interesting to hear people's views on that. And my final point, point three, is somewhat related, and it's really about which competencies we should afford higher priority. In the balance between ICT and 4D, the second one is more important. Tech skills can be relatively transient. Understanding what development is and how it does or doesn't work will last a lifetime and will ultimately guide you better. For very similar reasons, social competencies, maybe call them soft skills if you like, are going to get you far further than tech skills. We just look at any of the case histories of ICT4D failures, it's far more often human factors than technology factors that led to their downfall. And finally, competencies in dealing with the technologies that are widespread and are in use are of greater value than those relating to the digital cutting edge. I mean, I do acknowledge here that there's a potential tension between individual versus societal priorities. Probably as an individual, you may very well be more saleable in the ICT4D field if you can claim mastery of blockchain or machine learning or drone mapping, but your societal value is going to be greater if you have emotional intelligence and you can work out how to deliver a development project via, say, the basic mobile phone that hundreds of millions in rural areas still use. That's me. Thank you very much for your time.
Thank you very much, Richard. Now we like to engage in a discussion, and to kick us off with the discussion, I actually would like to ask the similar or the question to the other panelists. So what are you seeing as the main trends right now, or maybe the main trend, if you want to pick one specifically you're passionate about, or you're seeing in your organizations or at large, and maybe even something Richard either has mentioned or hasn't mentioned in his overview. So I will just ask Jodie first if you have a particular trend around digital skills you see and you like to highlight.
Thank you. I think it actually goes back to some of the basics. It's not even a trend. It's still that what we're finding more and more is technology is being introduced to so many different areas, whether it's health or education or agriculture. It kind of doesn't matter what sector that they're in. And we're making all kinds of different assumptions that people know how to do something. And we always need to make a step back and say, oh, know, we really need to find out, okay, what level are they at and what do they need to actually be able to know? So it's great that we have all these technologies that are doing amazing things, but we really need to recognize that people do not have those skills, and we need to really work with them to be able to do that. So it's really is going back to more the basics than anything else. Thank you.
Thank you, Jody. Derek, a similar question for you, either if there's any specific trend you have seen, or maybe even more so, anything that has changed now this year during the pandemic. Are there any particular skill gaps you're seeing and broad?
Yeah, thanks a lot for that important question, Sonja. It's a very pertinent question, especially given the times of COVID. We have seen a very high uptake of digital health literacy and ICT literacy. And within our organization, because of the restrictions that have been imposed by member states due to COVID, we're seeing a lot of utilization of those tools that were before neglected. And this is where the ICT literacy comes in. So a lot of our communication tools like Zoom, for example, Teams, Skype, those devices used for communication have had heightened interest from end users. I've just mentioned a few, but we have a number of tools that we're using for communication. Within the health sector, again, due to COVID, a number of digital health technologies have been fast-tracked, such as telehealth. More and more countries are asking for the adoption of telehealth. We have been implementing telehealth for the past 20, 30 years, but this particular era of COVID has seen a renewed interest in telehealth services, and more also in other digital health areas. And so the digital health literacy component has received a lot of attention. More and more users are wanting to, find mechanisms of how to search for the right information. And so there's a big program that we are activating called infodemic management, which is really the management of misinformation. That is one of the areas where we're seeing a lot of traction in these particular times. And so we see that the current pandemic situation, as catastrophic as it has been, it has underscored the need for fast-tracking digital health for the long term and also for the short term, given the current situation. So these are the two dimensions that we're seeing, being accelerated: ICT literacy as well as digital health literacy. Over.
Thank you, Derek. We hear a lot about technology, especially digital technology, the use of it being fast-tracked this year. Mike, is this also something you noticed within your work? And we also had, maybe I'll leave it there, and then I have a follow-up question for you. So
I'll just briefly answer that. There was a quote from somebody I worked with who was regional director in Africa when I first introduced some of these tools, and it wasn't this year, it was almost 10 years ago. These tools aren't new. I think they're just being adopted more. His response when he saw it, he said, "This tool is amazing. I hope we don't use it for more bad meetings." And I think that's one of the best quotes I've ever heard on this. Yes, digital literacy is important, but we're talking in my context about learning. And what frightens me with the quick adoption is that tools are getting so good. They're intuitive, they're in the cloud, they're dependable, they're free a lot of the times. And I think people are very focused on the technology and always have been. And learning is not about technology. Technology is like a pen and paper. If you know how to write, that doesn't mean you're a novelist. And if you have a learning technology, that doesn't mean you are a facilitator. And I think that underneath the digital literacy, the core about learning digitally is ensuring that there is good learning taking place. Yes, digital literacy is important, but let's make sure we don't use these tools for more bad learning.
Thank you. Yeah, I have a follow-up question for you that came through our chat. Do you have any recommendations on internal training tools, like for uploading training only to employees in a trackable way?
That's a webinar or perhaps a course in itself. It really depends on the context of the group that you're working with. I'm working with a group right now that the people who are learning don't have emails, and that is stymieing us because all the learning technologies that I'm aware of so often are based on email access, email sign up, email, etc. And we're trying to figure out how can we do it so that we're communicating exclusively through phone numbers. That it really points out that your context is really important. So it changes from time to time. I will say specifically that where I'm focusing a lot right now is that the digital learning does not become, in Spanish they say exposition. It's in, the shorthand for English is the sage on the stage, where we're just talking at people. I think it's very important that you recognize that people need to learn for themselves. They need to study and then deconstruct, reconstruct, put it together, practice, etc. And so I'm doing a lot of blended learning, not blended the way it used to be discussed, where it's in person versus online, but more exposition versus exercises. Give people space that they can learn asynchronously, and then get together in a group and learn socially, discussing what are the challenges, what are the opportunities, etc. I apologize. I have children in the background. Welcome to the COVID world. They're making lots of noise.
Thank you. I also like to offer to all the other speakers to always chip in your thoughts as well. We like this to be an interactive discussion. We also had a few other comments from the audience. So yes, please do keep those coming. One is actually, maybe Richard, I'd like to ask you if you can see if you would like to answer this one. It says, a factor that we do not address directly is the behavior and organization change, the focus on digital literacy and proper data use skills. How can we ensure that CM is embedded and recognized and pivotal and has potential when addressed specifically?
So I think that sort of speaks very much to the kinds of things I was talking about in relation to the competencies that make up an ICT4D champion, that it goes beyond the kind of specifics of building ICT4D systems, and it's also about managing projects. And of course, an integral part of managing projects is going to be managing change. And I would just reinforce that other point, that it's also about understanding the wider context for the organization as well, about the development context and what development means and how development is done. I think in terms of how we do that, of course, the very sort of simple thing to say was, well, you need to put that down on the curriculum for your training or your teaching program. Probably one thing we haven't talked about very much and maybe haven't thought about that much is not just about the content of your curriculum, but about who's planning it and who's delivering it, and how are they delivering it as well. Mike's just talked somewhat about the kind of the issue of how it's delivered, but I also think it's interesting to look at who is planning ICT4D training, because there's a danger if it's just sort of, say, handed over to your IT services function and taught by people with computer science backgrounds, that sort of thing, or tech backgrounds certainly, that they will necessarily reflect their own worldview in terms of the content that they put into those curricula. So you probably need to backtrack right into that process of thinking about who's planning training and teaching curricula. And again, that would go back to the point that was made earlier by Mike and others about the need for collaboration, but not just sort of collaboration in terms of the organizations, but probably also collaboration in terms of the disciplinary backgrounds or the world views of the people who are coming together to plan and to deliver these various ICT4D capacity building initiatives. Thanks.
Thank you. Yes, I couldn't agree more. We also had a lot of comments, particularly addressing the aspect of inclusivity. So following up on Jodie's comment, going back to basic, one of our audience members said they continue to hear more about bandwidth issues, cost of internet, and also just impedant uptake of digital technologies. So we have, yeah, actually, maybe Derek, I could ask you first, particularly looking at inclusive digital training. There's a specific question addressed at you. Is there any use case where local technology hub has been set up to bridge into the internet? We actually want to test a system where health facilities in a particular LGA could connect to a resource in and being hosted where there is not an internet. So do you have any use cases or examples, particularly dealing with in areas with a low connectivity or limited internet access?
Yeah, thanks, Sonja, for that important question. That question is actually very vital because when we talk about universal health coverage, we also like to say leave no one behind. We also like to say leave no one offline. And so this particular question indeed increases our ability to reach the masses where they are in the spirit of universal health coverage. Now, there's been 2 countries at least where we have discussed this issue of increasing access and reducing costs, which are normally heightened because of passing traffic through the internet. This is where collaboration with ministries of ICT comes in handy, because mobile operators are able to create what you might call a closed network of facilities, so that those particular facilities are not going, accessing, the traffic is not passing through the internet, which is what tends to increase the costs. And so this has been discussed in a few countries, and what the use case there was that there was a medical record system. And so what the ministry was requesting the mobile operators to do was to create a closed network of those facilities. This is really a dedicated pipe whereby the access to the medical record systems data by the ministries of health would go through that particular pipe as provided by the mobile operator. And so, and that particular use case was brought about because the ministry wanted a central hub of facility data. So the key question is, if you take modems into those facilities, internet modems, for example, basically, your data traffic of your medical record data would actually be going through the internet before it comes through the ministries of health. And so the discussion then was to approach the mobile operators to ensure that, to explore possibilities of passing the traffic via a closed network, as I've described, so that the data is really confined within that network and not going up to the internet. So these kinds of discussions are normally encouraged to take place between the authority in charge of the mobile operators, because the incentives are managed with the authority in charge of the mobile operators. These normally are the ministries of ICT or the telecommunications operators. They will know exactly what the capability of the mobile operator would be like. And so if you're asking for reduced costs, such as this particular use case I've talked about, we have encouraged countries to make working arrangements with the ministries so that they can better leverage the mobile operator's capability with creating things like such things as closed networks. Other areas we've seen in other countries is that there's been a research in using the same kind of technology used for broadcasting services as a means to create a nationwide bracket of, or shall I say, a closed internet, a closed network loop which does not go to the internet, but surfaces within the country. This has been at least discussed in one country that I'm aware of. I'm not sure of the results. But the key to this question is for us to improve access, we have to engage the ministries in charge of managing access, which are the ministries of ICT. In turn, the ministries of ICT must really always engage the telecommunications operator, which is a private sector, to harvest some of the capabilities, to improve access, to improve reach, and so forth. So yeah, so these are some of the use cases I'll speak about. Again, this use case is important because universal health coverage requires that we leave no one behind and that we leave no one offline. Over.
Thank you very much, Derek. And any of the other speakers would like to add a comment, particularly around inclusivity and maybe even what other roles other partners, like Derek just mentioned, the government or the private sector could play?
I would like to add to that. Yes, please. As we know with COVID, we have millions of people, especially students, that do not have access to education right now. So the fact that technology isn't evolved and people are expecting to be able to do remote learning using the internet has come to quite a head. I think what's been really interesting in trying to make it more exclusive is people are paying more and more back attention to radio. That was really big 50 years ago or so, and there's been many organizations who have been using it over the last 50 years, but that actually is much more inclusive than trying to get access to the internet. So you find lots of places where they're using radio much more for lessons and for communication, as Derek had mentioned. And then in terms of trying to get materials as well, I mean, as soon as the internet came out, the first question was, well, there's lots of people who don't have internet access, and how do we make these things available offline? So there's been work being done ever since I know I've been involved with this of how do you be able to get access to resources. So there's lots of different groups that have been really working on that, whether it's eGranary or Solar Spell or Colibri, in terms of how do you make these resources available offline. And then additionally, there's groups like through UNICEF GIGA, which is trying to get internet access across to all different schools. So there's a range of different initiatives in terms of how do you bring resources and create literacy to these different groups. Thanks.
Thank you. And now may I please also ask Mike and Richard for any I guess, closing statements, whether either around the topic of inclusivity or maybe skills gaps, or one of the questions was also if you think that the uptake of digital literacy adoption will continue after the pandemic as well. Maybe I can ask Mike first and then Richard to give us our closing comments.
First, I want to pick up on what Jody said about radio. And I think it's really important to remember that the technologies in ICT4D have evolved over the last 2,000 years. And the first reference I see to distance learning comes actually from the Bible. The letters to the Ephesians, the letters to the Corinthians. It was the use of people, pen and paper, to reach people that otherwise couldn't come face to face. And it's been evolving ever since. And I think it'll continue to evolve. The challenge I talked about with people with only phone numbers, I've been doing text message-based learning programs on COVID preparedness over the last few months. I think there's more to come. Having worked on adoption of digital learning for a good almost 20 years now, I think at the beginning, the framework of the conversation was, yeah, this is good, but it's not as good as face-to-face. And I think that's changing, and it's changed a lot already. I just finished a course that was it was a MOOC-like course, digital online. And I had a lot of people from Special Olympics on there. And included was the vice president of their finance department and a woman who was a volunteer for the organization in Japan. And I got feedback from both of them individually. One of them saying, the vice president saying, this is awesome, I love it, it's great, this is just what I want, and it was new to him. And I also heard from the volunteer who was disabled, and she said, this style of learning has been great for me. I can take the time to where it is. I'm ready to take my certification, and I know I'm going to pass. And I just look at that feedback as, yes, there are parts of face-to-face that are very difficult to emulate and are really important. I call it prime time learning. But there's elements of virtual learning that get to this inclusivity, that get to the learning styles, that give people the space to learn that I think often we're missing in face-to-face. And I think the key as we go forward is to treat these as toolboxes and recognize that face-to-face is your prime time, it is your premium, it's your ultra social, and plan it accordingly, and then blend in your technology assisted so that it takes up a lot of those not prime time activities, those inclusivity, those reaching out to scale. And I think that the challenge as we go forward is to be much more selective on how we use each tool in the toolbox and recognize it is not an either or proposition.
Thank you very much, Mike. And I've just noticed we are already at the end of our webinar. This time went fast so quickly. Thank you so much for all your comments and also for the questions. We will do a little write-up and also share the resources afterwards. And yeah, thank you so much for joining us, for the contributions, also for NetHope for hosting us. We also started an ICT4D conference podcast with new short interviews being published every Friday. And before you log off, please also fill out the NetHope webinar satisfaction poll and let us know your thoughts about this webinar, what we can improve or what we've done well. And thank you very much. And I wish you all a great rest of your day. Goodbye.
Thank you, Sonia, and thank you to all of our presenters for today. And thanks to our audience as well. As Sonia mentioned, please complete the webinar satisfaction poll and look out for that follow-up email with links to the recording. Thank you again and have a great rest of your day.